Are you constantly battling with bloating that just won't go away no matter what you eat or how much you exercise? It might not be your diet or your activity level that's at fault. It could be your hormones. And today we're diving deep into the world of hormonal belly bloat. We'll uncover the hidden hormonal culprits behind this frustrating condition, and I'll share some tips on how to manage and minimize bloating effectively. If you're ready to say goodbye to that persistent puffiness and hello to feeling more comfortable in your clothes, keep watching as we crack the code on this mysterious symptom. Welcome back to my channel. I'm Dr. Renee. I help women balance their hormones naturally. And before we get into it, a little disclaimer. The videos on this channel are for informational, educational purposes only. They're not intended to be taken as professional medical advice. While I am a doctor, I am not your doctor. So do me a huge favor. If you have a medical concern or a health need, please consult your own personal doctor or healthcare practitioner. Okay, with that out of the way, let's get into it. Okay, what exactly is this thing we call hormonal belly bloat? Well, it's a term that we often use to describe abdominal bloating that results from hormonal imbalances. This type of bloating is not just about, feeling a little full or having a little gas. It involves more persistent swelling, discomfort, or a feeling of fullness in the abdominal area that's tied to either fluctuations or imbalances in your hormones. Now, hormonal belly bloat is particularly common during significant hormonal shifts in a woman's life, like when she gets her period, pregnancy, menopause, and perimenopause. But it can also affect anyone with hormonal imbalances, regardless of the stage of life that they're in. And before we get into what causes hormonal belly bloat, I'd love to invite you to a completely free masterclass that I'm doing on May 15th. If you're a woman tired of feeling sluggish, out of balance, and just not yourself, this masterclass is for you. I've distilled years of research and practical application into 3 powerful strategies that address the root cause of hormonal balance naturally. This masterclass is your key to unlocking a healthier, more vibrant you. So I'll be sure to drop the link to sign up below. Okay, now back to what causes hormonal belly bloat. Of course, it's called hormonal belly bloat for a reason, because it's due to shifts or imbalances in our hormones. First and foremost, we need to talk about estrogen. As a woman approaches menopause, the levels of estrogen can fluctuate significantly. High levels of estrogen can lead to things like water retention, which often manifests as bloating. On the converse, low estrogen can impact the rate at which your body metabolizes food, which can also lead to bloating. Next, we have progesterone. Lower levels of progesterone tend to occur during perimenopause, and this can in turn cause a slowdown of the gastrointestinal tract, which in turn can lead to increased gas and bloating as food is digested more slowly. And then, of course, there's the stress hormone cortisol, which plays a role. Changes in stress levels during perimenopause can in turn affect cortisol levels, which can influence things like fluid retention and fat distribution in your body, which all can contribute to abdominal bloating. Changes in insulin sensitivity can occur during perimenopause, and these changes can influence how your body stores fat and how your body manages its blood sugar, both of which can potentially lead to bloating. Then we have leptin. Nobody ever talks about this hormone, but it's crucial for regulating energy balance in your body by inhibiting hunger, which helps to regulate body weight. Something called leptin resistance is where your body doesn't respond adequately to leptin signals, and this is common as individuals gain weight or they experience hormonal changes. This resistance can lead to things like overeating, weight gain, and increased fat deposition around the abdomen, potentially again contributing to feelings of bloating. Then we have the thyroid hormones, T3 and T4. They regulate your metabolism, and any imbalance can affect your digestive system. Low thyroid function, also known as hypothyroidism, can slow down the GI tract motility, leading to things like constipation and bloating. It's not uncommon for women in perimenopause to experience shifts in thyroid function, which again can exacerbate symptoms of bloating. Then we have a hormone no one ever talks about, DHEA. It's produced by the adrenal glands. It's a precursor to the sex hormones, estrogen and testosterone. DHEA levels decrease naturally as we age. And these lower levels can influence your overall hormonal balance, impacting your metabolism and your body composition. So while DHEA itself may not directly cause bloating, its impact on overall hormonal balance can indirectly influence factors that lead to bloating, such as fluid retention and fat distribution. Okay, before we get into what you can do about hormonal belly bloat, I just want to pause for a second to ask you, did you know that I have a program aimed at helping perimenopausal women rebalance their hormones? Well, I do. So if you're a perimenopausal woman dealing with many of the symptoms that I talk about on this channel, and you want to take a more holistic approach to your health, here's what I'd invite you to do. Number 1, be sure that you subscribe to this channel. Number 2, come find me on social media so we can connect there as well. And lastly, consider joining my signature 12-week hormone balancing program, the Hormone Code. This is for the woman who's tired of trying to figure things out on her own, and she wants help in designing a personalized health plan just for her. If this is you, then I'd encourage you to apply for a call. I'd love to see if working together is a good fit for both of us, and I'll be sure to put the link to schedule a call below. Okay, so now back to what you can do about hormonal belly bloat. Let's first begin with lifestyle modifications because there's a lot you can do to impact your hormonal balance. For obvious reasons, avoiding endocrine disrupting chemicals is important. So try to cut down or cut out plastics. Use non-toxic personal care products. And did you know that there are hidden toxins lurking in your kitchen? Yep. So I put together a guide that will help you detox your kitchen. And I'll be sure to drop that link below. Next, we have to focus on the health of your gut and your liver. So of course, we have to talk about diet. I want you to focus on a balanced, whole food, fiber-rich diet. Avoiding artificial sweeteners as much as possible is also key since many artificial sweeteners can cause bloating. And of course, hydration is necessary to diminish bloating. And of course, avoiding alcohol or cutting down on your consumption and avoiding excessive use of over-the-counter medications is optimal in promoting the health of your liver, which in turn is essential for optimal hormone balance. Next, moving your body will help with gut motility. So whether it's 30-minute walk twice a day or just even walking after meals, this will get your gut moving and improve your insulin sensitivity. And of course, getting adequate sleep will help with the bloating because sleep helps regulate hormones like leptin, ghrelin, cortisol, insulin, and growth hormone. And of course, we talked about cortisol and stress. So stress management needs to play a part in controlling your hormonal belly bloat. All right, now let's talk about a few supplements because I know y'all love to talk about supplements. Number 1, glutamine, my favorite. This amino acid is excellent for your gut health. It helps to repair and maintain the gut lining, which prevents unwanted substances from leaking into the body and causing inflammation. Next, we have aloe vera. This plant is commonly used to soothe and heal GI tract irritations. It can help with digestion. It can help naturally cleanse the digestive system, which will help in eliminating toxins. And it can also help to decrease inflammation in both your gut and your liver. Next up, we have collagen. While more famous for its benefits for skin and joints, collagen peptides can also support your gut health by repairing the intestinal lining and maintaining the mucosal barrier. This can help in preventing inflammation and improving your digestion. Then we have probiotics. These are beneficial bacteria that help maintain the health of your gut microbiome, which is essential for digestion, eliminating toxins, and just your overall gut health. Probiotics can reduce symptoms of bloating and improve your bowel regularity. Then we have prebiotics, which nobody ever talks about. These are fibers that feed the good bacteria in your gut. They help maintain a healthy GI tract, which is crucial for proper detox and hormonal regulation via the gut-liver axis. Then we have my favorite, milk thistle, also called silymarin. Milk thistle is known for its liver protective effects. It helps to detoxify the liver. It promotes in regenerating liver cells, and it can help support your liver function by reducing inflammation in your liver and protecting against liver damage. Then we have turmeric. This spice has potent anti-inflammatory processes and can support both your gut and your liver. Curcumin, the active compound in turmeric, has been shown to improve liver function and reduce inflammation. And last but not least, we have omega-3 fatty acids found in things like fish oil and flax seeds. Omega-3 fatty acids can reduce inflammation in your body, including your gut and your liver, and they can support your overall cellular function. And of course, bioidentical hormone replacement may also be an option, but this is something that you need to speak to your doctor about. Sometimes unnecessary and unindicated hormone replacement therapy can make matters worse. So, when it comes to hormonal belly bloat, just know that you're not alone in the struggle, and understanding your body's hormonal signals is the first steps towards relief. If you have questions or you want to share your own experiences with hormonal balance, drop a comment below. I love hearing from you. And if you enjoyed this video and you want more information on how to beat the bloat after vacation, check out this video where I talked about 4 tips to feel less swollen and sluggish when you return home. And with that, we'll see you right back here next week. Ciao.